So over to Dr. Rijita Tripathi to moderate today's English session.
Thank you, sir. Thank you a lot. Good evening to all IFPH members, doctors, friends. Now it's time for our English session. Myself, Dr. Rachita, today's moderator, and this is our 2125th day of continuous webinar of IFPH, International Forum for Promoting Homeopathy, on 26 June 2026, Friday at 8:30 p.m. And before proceeding, let's have 1 minute silence. And our today's guest is Dr. SHWETA SHAH MD, Homeopathy. She is Associate Professor in Practice of Medicine, Homeopathic Consultant, We Care Scientific Homeopathic Clinic, Kolhapur and Jaisinghpur, Maharashtra. And her today's topic is PCOS, that is Polycystic Ovarian Syndrome, decoded with diet and homeopathy. Uh, Welcome, ma'am. A very warm welcome to Dr. Shweta. Now you can start your presentation, ma'am. Since sir, ma'am is not there.
Yes, Dr. is
Doc-
here. Nice.
Shweta.
Yes, Dr. Seda, you are the co-host now. You can share your screen. You can talk also. You can.
Yes, I'm just sharing my screen.
Okay.
Uh,
Just click on the screen so that you can see the options. Share. Just simply click on this screen where you can, from the extreme right, you can see the second one is share. Have you seen it?
yes,
Then you share. Okay, it's fine.
it is
You're,
fine. Okay.
yes, it's fine. It's fine. You can go ahead.
Good evening, everyone. Myself, Dr. SHWETA SHAH, and today my webinar topic is PCOD decoded with diet and homeopathy. So, in today's webinar, we are going to discuss about three types of diet. If given in PCOS patient, it will give wonderful and successful results in PCOS patients. And at the end of the seminar, then you will become confident about application of diet and homeopathy in PCOS cases by solving quiz questions also. And also I'm going to discuss my successful case of PCOS with you all, which in which I have decoded this case with diet and homeopathy. So let's decode this diet and homeopathy PCOS. First of all, I want to share with you all that everyone knows that this is the normal physiological 28 days menstrual cycle. Here, because I want to start with this slide, because PCOS is basically we all must have to go through 1 minute by this physiology of menstrual cycle. Here, from day 1 to day 5, there is a menstrual phase. We all know that, where all hormonal levels are low. After that, follicular phase comes, where estrogen and FSH levels increases, where egg matures, and after day 14, there is a ovulation, where luteinizing hormone surges, and then till the day 28, there is a luteal phase. So I'm not going into detail in this physiology of menstrual cycle, but PCOS is all about after this pathophysiological changes happens in hormonal level. So this is important to know about that this normal physiological cycle. Okay. Today's my topic is PCOS? It is because in our daily OPD, we see lots of PCOS cases. In every week, there is a one woman come with a complaint of PCOS majorly. And what happens many times, there is a because of lack of our because of there are some obstacles. So many times it is not getting cured. So today we have to discuss about it, as many times we miss to diagnose PCOS because we don't know how to decode this PCOS, because patient come with multiple complaints. So there is a the problem is there is every one woman is suffering after 5 Indian women which is suffering who is suffering from PCOS. So this is the one of the leading cause for infertility, and 70% patients remain undiagnosed of this PCOS. So this is a one disorder, and there are many phases. Like patient may come at your OPD by complaint of irregular periods. May patient complains about acne, hair fall. Sometimes patient has complaint of weight gain. Sometimes there is infertility or anxiety and mood changes also present. So my friends, don't miss this diagnosis, because any of this complaint if patient is having, maybe she is suffering from PCOS. Remember this always. So today let's decode this PCOD with diet and homeopathy. So this is the now I want to tell you that PCOS is not more now PCOS, it is renamed as PMOS, because PCOS means polycystic ovary syndrome, but now it is polyendocrinal metabolic ovarian syndrome. We have to call it as PMOS. And yes, it is affecting over 170 million women worldwide, and day by day this number is increasing. So scenarios of PMOS are increasing day by day. So there is a need to know about in detail about this PMOS, how to crack this cure. So before going to further, I want to know you that there is a criteria, diagnostic criteria, which we have to know, that is Rotterdam criteria, where if any of out of these complaints are present, then you must have to diagnose it as this is a PMOS case, like oligo or anovulation, hyperandrogenism, polycystic ovaries. So out of these three, if two are present, then this is case of PMOS. So this is the evolution of diagnostic criteria, which is changed now, and the PCOS renamed as PMOS. Okay. So today's my topic name, as I told you that this is PMOS, that is decoded with diet and homeopathy.
Hello,
Okay.
ma'am. Screen is not visible.
Screen is okay. So why this diet is important in PMOS? Because what happens, there are many times. Okay, what is this? Why diet is important in PMOS? And why homeopathy is important in PMOS? Because every time what happens, we give homeopathic remedy in PMOS, and patient comes again and again after some time of interval. So if we give diet in this situation, then there are no any chances of returning of this PMOS. Okay, so let's know about this diet. Why diet is in PMOS is important, because it is considered as obstacle in cure pathway of PMOS, as it is given in aphorism number 260 by Dr. Hahnemann, where Dr. Hahnemann says that there is a in 260 aphorism, Dr. Hahnemann said that in the diet and regimen, if errors are present, then and they are always pass unnoticed. So this is important to decode the diet, which is very much important. So without diet, it's like mopping floor with tap on. Like if the tap is on and we are continuously mopping, then there is a no cure we get. So and real challenges into overcome of the cure of the pathways spike of insulin. So this spike of insulin we can control with the help of diet. So that's why diet is important in PMS. So how we are going to decode this diet? With the help of this, as I said earlier at the beginning of this webinar, I am going to tell you these three types of diet: Mediterranean diet, ketogenic diet, and light fasting diet, which are already described in my upcoming book, The Hormone Healing with Diet and Homeopathy. So detailing of this diet, today I'm going to disclose with you. I'm going to share with you this diet in brief. So first we know that if in these three diet we used combinedly in a patient, that is structured dietary pattern for PMOS, Mediterranean diet and ketogenic diet and light fasting diet, if we combined with targeted nutrient supplementation, like if patient has vitamin D deficiency, inositol, omega 3 fatty acids, so it will give us results like improving in insulin sensitivity. As we all know, pathophysiology of PMOS, there is a insulin resistance in patient. Then there is a hormonal balance, so it improves hormonal profile also of the patient. And also there is a lack of ovulation, anovulation, many times oligoovulation is present. So it will improve your ovulation function also. So this is the innovative approach which shows promise and gives successful results in PMOS. So we can use these three diets combinedly also, and that I'm going to tell you how to do this combination. Okay, so before doing this combination, before knowing how to do this combination, we will know how to we will know differently how the Mediterranean diet, how the ketogenic diet, and how the light fasting diet is there. Okay, so first all these resources are taken from my upcoming book, The Hormonal Healing, Diet and Homeopathy. Then now we will start with the Mediterranean diet. So let's discuss in little or in brief about this Mediterranean diet. Why Mediterranean diet works for PCOS? Because it is having low glycemic index. So my friends, low glycemic index means the food which contains low glucose. So you have to first rule out that patient is taking the food which is having low glycemic index or high glycemic index. There is a simple OPD rule for PCOS, which is if patient's belly is high and patient is having irregular periods, and sugar cravings are also there, so you need to start with low glycemic index diet, because it means patient's glycemic index crash is in body is high. So this is a simple OPD rule. Whenever patient of PCOS comes in your OPD, you have to check whether patient's belly fat is there, patient is complaining about irregular period, and patient is also telling you that yes, I'm having sugar cravings in the evening. So this means patient is in patient's body there is a lots of insulin saturation is there, and she must have to take low glycemic index diet, and Mediterranean diet gives us low glycemic index. So how to check this glycemic index of your meal also? First, we will start with you also, and you can apply this on your patient also. So use this 3-point check. First point is color rule. That is white color. Whatever rice is white, maida is white. So the white color food is always containing high glycemic index. If brown or green color food is there, that is low glycemic index diet. That means brown rice, green vegetables it contains. So white rice is bad and brown rice is better. Jowar is best. So use this first color rule in your food. Then secondly, protein plus fat rule. What is that protein plus fat rule? It means that food that contains both protein and fat, both. So if you are taking these type of food like dal that contains protein, ghee that is fat, good fat, eggs, nuts. So these are protein and fat mixture. So if this is your food, then it is lower glycemic index. Suppose, for example, if it is plain roti, plain wheat roti, then it is higher glycemic index. But the same roti is with dal and ghee because it is combination of protein and fat. So so the food will become lower glycemic index. And the third rule is crash test. So crash test is very simple. What is that crash test? It is if you feel sleepy or hungry 2 hours after your meal. So that it means that you have taken your food which was having higher glycemic index. And if you feel energetic 4 hours even after your food, then the food was having low glycemic index. So in this way, you can check your glycemic index, and glycemic index is very much important in Mediterranean diet. So first check the glycemic index, then quick rules of this glycemic index, add protein or fat to carbs, then GI drops. And for example, as I said before, if white rice is only present, then it is high glycemic index. But if white rice is with dal and ghee, then it is having medium glycemic index. Another example is also I'm giving you that if hot boiled potato only single taken, then it is higher glycemic index. And if that cold boiled potato, if you take like in salad, so it will contain lower glycemic index. So in this way, you can drop your glycemic index of your food. Okay. So now, what is Mediterranean diet? That we have to advise to patient, and after that patient will can consume it freely. Okay, so vegetables, grains, proteins, dal or beans, fruits and fats, all this food which containing low glycemic index is Mediterranean diet, can be considered under Mediterranean diet. So the grains like jowar roti, bajra, ragi, brown rice, these are all can come under this Mediterranean diet under grain. Then dal, beans, like you all know that all type of lentils, vegetables, all type of vegetables, especially green vegetables. And if a patient is taking it in raw form, then also it contains lower glycemic index. Then fourth one is fruits. Many types of fruits we can advise in here. And proteins and fats. The good fat means that food which is good for good in diet of PCOS. Like these type of all foods we can consider under in Mediterranean diet, and it is all having low glycemic index. So now we will see how Mediterranean diet will fix the individual PCOD problem. If patient is complaining only about high insulin, then from Mediterranean diet we take fiber, olive oil and no sugar, then the patient's insulin stays flat. If patient will complain to you about PCOD with weight gain, then you can take from Mediterranean diet nuts, proteins, so that patient will feel full stomach and there is a no craving. So no craving means no chances of weight gain. Then if patient is complaining about irregular periods, then you can add in Mediterranean diet healthy fats, so hormone will become balanced. And lastly, facial hair or acne present complaints by patient, then give her omega-3 from fish or nuts or seeds that can lower her testosterone. So in this way, Mediterranean diet can fix the PCOD problem with with our constitutional remedy. So now if I'm saying that constitutional remedy also we have to give with this diet. So now when remedy matches, how to apply this Mediterranean diet? This is one of the interesting point here. I want to mention that if suppose, for example, patient is constitutionally pulsatilla. You have taken case and now you know that patient is of pulsatilla. So now you all know that pulsatilla is thirstless. She needs fats. She has craving for fats and her mood is constantly swinging. Then from Mediterranean diet, if you prescribe her walnuts, berries and olive oils regularly, especially walnut and berries, then you can control all of these her complaints also with the help of pulsatilla, and with the help of Mediterranean diet you can give her much more relief. Now if patient is of thuja, now thuja is psychotic, we all know that, and there is lots of warts, that is representation of toxin saturation in her body. So here needs zinc for detoxification. So how this detoxification can happen? So that can be where we can use this Mediterranean diet that contains pumpkin seeds, chickpeas, green vegetables. So add this low glycemic index diet from Mediterranean diet in the patient's thuja patient's diet. The another example, that is last example, calcarea carb. Many times patient of PCOS, if she is obese and she needs high protein because there are lots of fat saturation, and also there is a constipation may be present in patient. So we have to boost her metabolism also. So in this case, you can use fiber, lentils, as we have to give her high protein. So you can add lentils, and fats, good fat is ghee, and also protein content eggs. So this will become her low glycemic index diet in her regular food. So in this way, we can apply remedy plus diet in the patient of PCOS, and we will get surely we will get successful results in PCOS. So this was about Mediterranean diet. Now, out of 3 diet, first was Mediterranean. Now second is ketogenic diet. This ketogenic diet is really successful and always powerful. Why? Because it has high fat and low carb. That is about ketogenic diet. So now we will decode this, how we are going to apply this ketogenic diet into the PCOS patient. There is a research happened and which was published in Journal of Translational Medicine in 2020, where researcher mentions that patient of PCOS has followed 12 weeks ketogenic diet, and that reduced her weight 12% and lowers her testosterone by 30%. And out of 11 women, 8 women were successfully got their natural periods. So this was a research happened also, which was published in this renowned article. So now keto diet means very low carb and high fat diet. It forces your body to burn fat instead of sugar. What do keto diet is? It burns fat instead of sugar, and for PCOS, keto directly attacks the root cause, which is insulin resistance. We all know that pathophysiology of PCOS, where insulin resistance is very important point. So it attacks to the root cause, which is insulin resistance. So ketogenic diet is planned especially for those PCOS patients who don't have menses from 6 months. And after 6 months, after this diet, if patient is following, then she will get her first natural pill. This keto helps in PCOD by crashing insulin. What is the common formula for keto diet is it lowers insulin. Lowers insulin means it in the patient of PCOS there is a always spike of testosterone. So because of high testosterone there is a amenorrhea is present. So in this case, what happens if ketogenic diet followed by PCOS patient, there is a it lowers insulin, that causes lower testosterone, and that will helps in to returning her periods. So how keto will help step by step, we will see now. From day 1 to day 3, suppose this is you have advised to patient, if you have patient obese, she has already 10 to 15 kg weight gain, there is weight gain of patient by 15 kg, then you must advise her keto diet. So for the first 3 days, she will go through keto flu. What is keto flu? Keto flu means extreme tiredness. She will feel extreme tiredness because of keto diet is very much harsh, because it contains mostly only proteins and fats. And what happens here is there is a, because of that there is a insulin crashes and patient feel weakness and tiredness, and that is we call it as keto flu. So for after 3 days there is a from day 4 to 14 patient feels energetic because body makes ketones from fat, brain also uses ketones, and that gives her energy. What happens after third week? From third week to 8th week, insulin stays low all time. Insulin will be going to lower. Testosterone also drops, and what happens because of testosterone levels drops? There is a new hair stops. There is a new hair growth always there on unwanted area, that will stops her new hair growth. If patient continues that diet till third month, what happens till third month? If ketogenic diet is continued by patient, luteinizing hormone drops, FSH also rises, and that will help in maturation of follicle. When maturation of follicle happens, there is a ovulation, and patient will get her natural periods. And from third month to 6th month, when patient continues this ketogenic diet, cyst naturally shrinks on USG, and patient's weight loss also happens by 15 kg, and patient get clear skin also. So this is the step-by-step ketogenic diet, and it is always given with the constitutional drug. So keto diet and homeopathic remedy if given together, if Thuja and sepia patient are there, in this patient keto diet works fast. But if patient is pulsatilla type, that pulsatilla cannot continue this type of diet because ketogenic diet is too harsh, and there are chances of quitting by her this diet. So always give low glycemic index diet to pulsatilla, and prefer keto diet to Thuja and sepia type patients. Now, in which patients we cannot give keto diet? There is a restricted keto diet in patients with thin PCOD. If patient is not obese, patient is thin. If patient's thyroid TSH level is, patient is having thyroid disorder and TSH level is more than 4. If there is a history of eating disorder, if patient is planning pregnancy, then also don't give her keto diet. And in the cases of where gallbladder removal has done, warning when not to use keto in PCOD. As I said that why warning is there, because keto can worsen thyroid if a thyroid disorder is already present in patient. In thin PCOD like Natrum-Mur, if patient is Natrum-Mur type, then already in Natrum-Mur patient hair fall is present. So because of ketogenic diet, there is a more weight loss and more hair fall chances. If patient is planning her pregnancy, then there is a unnecessary weakness patient can feel because of ketogenic diet. So switch her to Mediterranean diet and don't give her ketogenic diet. Then these are some of the warnings that when we cannot use this ketogenic diet. But if these conditions are not present in patient, then you can confidently give this ketogenic diet to the PCOD patient. Now this was about ketogenic diet, Mediterranean diet. Now the third one is that is light fasting diet. So what is this light fasting diet? Let's decode this light fasting diet. We can assume that in the name only, fasting diet means patient has to do fast in the form of diet. But this fast is not kind of patient has to live for fast for day, for continuous 2 days, 3 days. It is not that kind of fast. It is structured fasting diet. and which is light fasting diet, which we call it as light fasting diet. So let's decode this diet. Before decoding this light fasting diet, we will go back to the pathophysiology, so we can get to know the idea of light fasting diet. Exactly what is the idea behind this application of light fasting diet? We all know that in PCOD there is a excess saturation of insulin present in blood, and during PCOD this is almost again increasing saturation of insulin in the blood. So during fasting, if we give if we given or advised to patient that do light fasting diet, then what happens during fasting? Patient don't consume food during for some hours, so that there is no chances of accumulation of insulin in blood, and insulin in blood become lower. What is that? The fasting means there are three methods of fasting, light fastings. One in first method 12 as to 12, in second method 14 as to 10, and in third one there is a circadian fasting. That means sunrise to sunset only fasting. So in this first method, patient is going to fast for from 8 a.m. to 8 p.m. So that means patient remain empty stomach for 12 hours. And in this second method, that in where patient will remain 14 hours on fast, so that she can eat food from 10 a.m. to 8 p.m. only. And in the third method, that is from sunrise to sunset, patient can eat food only from sunrise to sunset only. And after sunset, she will remain empty stomach. So these are some of methods for fasting. What happens during fasting? Patient don't consume food for some hours. Like if we have advised patient that eat only from this window, eating window from 8 a.m. to 8 p.m. only. So from 8 p.m. to morning 8 a.m., what happens in her body is there are body takes time to crash the insulin, and it helps in crashing insulin which is already saturated in blood during these fasting hours. So what happens if insulin crashes? That will help in reducing androgen levels, and where insulin saturation lowers in body and decreased androgen levels, decreased testosterone levels gives her periods naturally back. Here is simple formula. In PCOS, there is a insulin resistance is there. So if we advise patient fasting, so that insulin production also get less, and when insulin rest, then testosterone drops, and patient, it will help to patient to get her periods normally back, naturally back. Okay, so this is about light fasting diet concept, idea behind this light fasting diet, and these are the three methods which I already told you now. What happen if method 1, 12 as to 12, if applied to patient, that is patient will eat from 8 a.m. to 8 p.m. only and remain 12 hours empty stomach. It is best for teen PCOS. This is suitable for teen PCOS patient or patient who is teenager. Then in 12 hours fasting, in 14 hours fasting, what happens? Their formula is 14 as to 10. Patient has to remain empty stomach for 14 hours, and patient can eat for 10 hours only. In this situation, deep insulin drop helps in fat burn, and after 12 hours, suitable for those who delayed menses more than 3 months, and patient who is having belly fat and sugar cravings also. Now, this is the third one method, where circadian fasting, we can call it as circadian fasting, where sunrise to sunset only patient can eat. And if patient is always also complains about there is a loss of sleep or sleeplessness, then this is the good fasting diet for her. Advise her this circadian fasting with your homeopathic remedy. So what happens here? This cortisol, if cortisol hormonal imbalance happened, then body will take time, and that improves our sleep pattern as cortisol secretion increases. Okay, so there is these are the light fasting methods for PCOD. Now, how we can apply this light fasting diet in practice with best suitable diet and remedy? As we already seen in Mediterranean diet, how low glycemic index diet will help in patient like pulsatilla and other constitutional drugs. How ketogenic diet will help in sepia, thuja patients. Now we will see how light fasting diet with remedy helps in patient. If patient's problem is belly fat with PCOS, then what light fasting does to this, body will burn its stored fat, which is already, if fat storage is more, then body will burn this stored fat. And what light fasting diet does with homeopathic remedy, it will help to calcarea carb, so that if already stored fat is burned by fasting, then calcarea carb will also work uh, successfully in this patient. Then a patient is if suffering from anovulation, already patient is suffering from anovulation, but if there is a lots of chances, means if patient is not having her period since 6 months, if more than delaying of menses there, then definitely it is anovulation. And what light fasting does here, that it will drop her insulin. By light fasting diet, her insulin will drop, her luteinizing hormone will drop, and ovulation takes place. So in this way, support, it will help. If pulsatile and sepia is given, then in infertility cases it will support this infertility cases of PCOS also. Then if sugar craving is present, patient is complaining that every evening by 6 p.m. I have craving for sugar, then it will reset hunger hormones like ghrelin and leptin, which are very much important hunger hormones. So light with the light fasting diet, you can control your hunger hormones also, and patient's hunger hormones also, and it will decrease their sugar craving. Like if patient is of lycopodium and already in lycopodium sweet craving is present, so this diet can help him in this diet. So, light fasting diet. If many times what happens, we advise to patient do light fasting diet, and there are chances of constipation. So here you can ask patient to take flaxseed supplementation also. Then start with how to apply this light fasting diet. First, ask patient to start with 12 as to 12. That is, patient has to remain 12 hours on fasting, and 12 hours can eating window is present there. So in this eating window, patient can eat the certain food. You have to which is low, which is containing low glycemic index. You have to suggest that food. Then always what happens after 12 hours, if patient is taking food from 8 a.m. to 8 p.m. or 10 a.m. to 8 p.m., then what happens, patient takes any kind of food when she breaks her diet. So always tell patient that first food must be containing protein. So protein first meal always, else fasting backfires, because again patient will get that food into form of carbohydrate, and it is not useful then. It is not useful diet then. So these are the two important rules in that we have to follow in the light fasting diet. And if we combine this diet with remedy like fasting, if we advise patient for light fasting diet plus if patient's constitutional is sepia, then fasting alone, if patient is doing fasting alone, so she there are chances of suffering from weakness. So it can help to overcome her weakness if we give her with remedy. So, like ketogenic diet, there are restricted to some patient. So, light fasting diet is also restricted to some. In some condition, light fasting diet is also restricted. Like in lean PCOD patient, as ketogenic patient is also not also restricted in lean PCOD. Then pregnant ladies because they cannot remain empty stomach for these long hours if patient is already suffering from thyroid disorder, and patients who are especially students and going through exams. So avoid this light fasting diet also in students also. So next question must be come in your mind, that what to eat in this eating window then. I have said that 12 hours patient can eat and 12 hours patient should remain empty stomach. So what she can prefer to eat in this eating window. So in light fasting diet, fasting only works if you break it right. As I said before, if you eat any carbs like poha, chai, after 14 hours, you just wasted the fast. So here, what to eat in eating window. Here I am giving you some tips that patient has to break her this fast with the proteins only. That is 30 gram minimum protein should be there, so that it stops insulin spike. Add good fat like ghee, olive oil, nuts in her diet. That slows sugar release, that is low glycemic index. Then fiber, vegetables and half plate vegetables should be present in the patient's plate. So that fiber also helps in insulin flattening. And lastly, carbs plus low glycemic index food, that is jowar, bajra type food. So this is the food patient have to consume during this eating window. Now, here ends the light fasting diet decoding also. Now we will summarize of decoded diet in PCOS. After this, we will take one quick quiz so that we will get to know what we understood from this today's webinar. So before going there, I will summarize all the points which I have today decoded from the diet pattern of PCOS. First of all, rule for all the diet is compulsory no sugar, no maida food, no white carbs, and dinner must be before 8 p.m. is a common rule for all diets in PCOS. Now in first Mediterranean diet, we have seen that vegetables, olive oil, fish, all low glycemic index diet is present, which helps in slowly fixing insulin, and it is safe for all PCOD patient. Because there are in Mediterranean diet there are lots of actually there are no restrictions in any kind of PCOD patient. So Mediterranean diet we can give to all PCOD patient, and it is best for everyone, beginners and lean PCOD also, where in ketogenic diet and light fasting diet lean PCOD patients are restricted. In keto diet, daily less than 20 gram carbs per day, eggs, paneer, ghee, no roti and no rice. That will help in crashing insulin fast, because we are considering keto in mostly patients who have delayed menses for more than 3 or 6 months. So that crashing insulin fast may help them returning their periods fast. And it is best for obese PCOD cases where no period 6 months, 6+ months only, and not for, it is not suggestive for thyroid and thin patient. And the last one is light fasting diet, where 12 is to 12, eat from 8 a.m. to 8 p.m. only, breakfast with 30 gram proteins, and it will help only, it will also help in insulin resting, and it burns belly fat. And it is best for all PCOD with sugar craving patients. So this is the short summary of today's decoded diet in PCOS. Now the quick quiz. Here you have to suggest me which diet should be there. The case, first case is 23-year-old female with PCOD, where history is patient is having 78 kg weight and height is 155 centimeter. From this we can draw her BMI also. And if patient is having no periods for 5 months, and patient is having complaint of face acne, thin hair, sugar cravings from 6 p.m. daily, TSH 2.8 is there, and wants pregnancy next year. So this is the case. So remedy is given. You don't have to choose remedy. You just have to suggest which diet to prefer in this case. A, restricted keto, that is no roti, rice, dal, only eggs, paneer, ghee for 3 months. Option B is 12:12 fasting plus Mediterranean diet. Then eat 8 a.m. to 8 p.m. jowar roti, sabzi, dal, nuts. Option C is normal diet. Option D is 16:8 fasting plus skip breakfast, and patient has to eat 12 p.m. 8 p.m. only and low calories. So correct answer is
Hello, ma'am. Someone is saying A.
option
Option
It's
A.
B. It's B.
option B, right?
Option B.
Best answer is option B, where 12:12 fasting plus Mediterranean diet we can suggest. Why A is wrong? Because in option A, there is a, if we given keto, it will become too harsh. And as she is planning her pregnancy, and as I said that ketogenic diet and light fasting diet is not given into the ladies who are planning for pregnancy, because there are lots of restrictions. Then C is wrong because it won't work, because there are less chances, as in the previous slides we have discussed about real obstacle in PCOS is diet only. And why D is wrong? Because in option D, we have said that there is a fasting plus skipping breakfast and it is low calories. So it will also become aggressive for that patient. And she is new to fasting, plus she is having thin hair. So there are chances of more hair fall. So always B diet, answer B is right, because 12 hours plus 12:12 fasting is good for her, and Mediterranean diet, which is containing low glycemic index, is good for her. Now, this is the case second. Here I will show you my OPD result after applying this diet and homeopathy in this case. So I am already telling you that patient is thin PCOD case, and she is Natrum types, and evidence is into the next slide I have given. So here what is the case? Listen carefully. History is 47-year-old woman whose weight is only 45 kg and height is 160 centimeter. Her period was absent since 8 months. She was in stress. She loves salty food, cries alone. Hair fall is there. Hair fall +2 is there, and dark circles are there. She only eats one chapati and sabzi only, and there are no sugar cravings. And her TSH is also increased. So which diet should we advise in this case? I will give you again options. You have to choose one option from that. A, B, C, D is there. A option is keto. Second is 14:1 plus fasting. 14:1 fasting. Number C is Mediterranean plus 12:12 gentle diet. And D is high carb. So which diet we can suggest in this case?
It's option D.
Option?
D.
No. Okay, I will tell you. The answer. It is C, Mediterranean plus 12:12. Why? Because there is a patient also needs good fats. So and she cannot fast beyond 12 hours. So here Mediterranean plus 12 gentle diet is okay. Only weight gain is not our goal. So here why others are wrong? Because option A, she is already underweight. Keto means more weight loss and hair fall. In B, 14:10 will be too harsh. TSH is also increased stress, so thyroid can worsen. So nitramur needs nourishment. And option D, more carbs, means again there will be insulin spike. There are C and D are going from hand in hand answers, but what happens in D, if we give only carbs, then there are chances of spiking of insulin, and that will worsen PCOD. Even if patient is thin, there is a chances of spiking of insulin. So there is only carbs we cannot give her. So answer C is right, where Mediterranean low glycemic index diet and 12 is to 12 light fasting diet can be advisable. And result of this USG report was patient had a simple cyst on her left ovary, and after this diet and homeopathic application, her ovaries became normal. There were no cysts. So this is about all the. This is about diet that is decoded in the in today's my webinar. Thank you for your patience. And for more references in all ages of hormonal changes in women, refer my upcoming book, that is Hormones Healing. All the diets and many homeopathic remedies I have prescribed in this book. So you can refer this book also. So thank you so much. Anyone have questions?
Ma'am, there are three more questions in chat box. Some Rohini Desai asking, what are the sources of this information? Who has carried out controlled research on this?
Okay. This resource, these references are taken, as I've already mentioned, that the upcoming book Hormonal Healing, Diet and Homeopathy, and as I've told that in some of I have referred many kind of reference books for diet, which are specially designed for different kind of hormonal changes, and that has triggered many type of different disease conditions. So mainly this is the only book where I referred, where I get these all references, from where I take these all references.
Okay, ma'am. Ma'am, one question from myself. And first of all, a very thank you and congratulations for your presentation. Ma'am, in the last case, na, TSH is not much increased, 3.9. I think the range is around 4.58 something in last case. As I know,
Yes, yes.
TSH normal
Yeah,
range is about till
normal
4
range
point
is
something.
from 4 to 4.5, madam. So
Yeah.
it is about on border level, and patient is already thin, and
Oh,
maybe it is patient is having hair fall also. So it is not thyroid disorder completely, but it is towards higher level. So it should be also considered during planning or designing your diet.
okay. Ma'am,
In the
are you also asking mental generals of these patients?
Yeah,
Actually,
mental general
mhm.
also we I have already told that we have already taken this case, and in our OPD the case is already taken, and constitutional remedy is now prescribed, and with the along with that prescribed remedy we have to design this kind of if we design this kind of diet, then we will get 100% result, because many times what happens, patient cannot lose her weight, or there are lots of times insulin spike issues, and so that will insulin resistance become one of the obstacle in our case.
I mean, all PCOD patients is important insulin spikes or not.
Yeah, because pathophysiology must be considered during every whenever we are taking any case, pathophysiology must be considered in every case.
So investigations are much important, na? In case of PCOD to know insulin resistance, LH, FSH, and DHES, like hormone, prolactin level. These investigations are important, na?
Yeah. Investigations are always important because without investigation, how can we conclude that case? If case we have to know where we are in the pathway of cure, where we are standing now. The
Oh,
cyst must
okay.
have be reduced, or a cyst is more getting more bigger now. So from the investigations we get only
Yes,
we
Okay,
only
ma'am.
get to
One of
know that
yes,
investigation
there are
is
some questions also there in the chat.
in chat box.
one.
Uh,
How
in,
to stop sharing the screen?
yes, I shall close it. Please wait. Okay. Individual constitution play is the question.
How to order the book? The book will be very soon coming on Amazon platform. The book
And
name is Healing Hormones with Diet and Homeopathy, and you can order this from Amazon and from Flipkart also. Since PCOS present differently in different women, what role does individual constitution play in selecting an anti-inflammatory diet among the Mediterranean diet, keto diet, and intermittent fasting? How do we decide which approach is best suited for a particular patient? Okay, a good question. That is why I have told that pathophysiology is important, and constitutional is very much important because here as we are going to prescribe on the basis of individualization, and concept is on the basis of individualization only, we have to plan or design that particular diet.
there's one more question.
And anti-inflammatory, if anti-inflammatory diet is best anti-inflammatory diet is Mediterranean diet. AMH, prolactin, testosterone total high than PCOD extreme.
चलो
Yes,
चलो
testosterone is
इसको देख
already
लो
high.
2 मिनट.
Is AMH prolactin is testosterone total high, then PCOD expect.
Yes. Okay. Sir, in PCOD, already testosterone levels are high only because it is in pathophysiology only that what does insulin resistance, insulin, whenever there is a more saturation of insulin in blood, it means it gives testosterone on high level only. So if we see PCOD pathophysiology, then you will get to know that there are already these all hormones are increased, and AMH level should be low, I think, in these conditions.
Anyway, yes, Doctor, the presentation was so excellent, and it's a different session indeed. Usually, people come up with the diet and regimen in a different way, but you have a different view or different kind of thought on this particular diet. But frankly, we can manage all those cases even with a simple diet, as well as the time is very important, as you point out. Most of the people nowadays used to take the suffering very, very late. And that is one of the reasons for, and sitting together with the family and they're taking heavy diet. That is one of the commonest cause for this fatty problem. And as well as this, as you know, that when the PCOD is there, naturally the hormone level will force some person to eat more, and eating in a heavy in late night is one of the biggest problem for the treatment or management of PCOD. So
Yes.
we need to do some more thing. The diet, the time is everyone. Whatever kind of diet you take, it should be taken at least 3 hours before bedtime, and that too in a simple quantity. And that is also very important. The quantity is to be reduced,
Yes.
and particularly the carbohydrate diet need to be reduced at night time. And in the morning also, it is better to take the food within 3 hours from when you wake up, or as soon as you wake up, you can take at least 3 hours. In between, you can eat the food. That is the best way. And a morning exercise is also very, very important for PCOS patients. But nowadays, what do is that patients may go to the gym in the night, and then after coming from the night, they may feel excessive hunger, and they may take heavy food. So whatever thing they done for health in the gym is wasted. So that also need to be corrected. The timing of all those things is very, very important, rather than what kind of diet. That is what I would like to add to this session. Anyway, congratulations and thank you for coming over here and presenting such a beautiful session. Even though it's the first time you are coming over here, hope we can have some more presentation in a different side. And
Sure, sir.
once you publish the once you publish the book, we can arrange another session so that we can do an inaugural session for that also here in this forum. We are really so that everybody will get a chance to know what is happening with your book. Okay. So tomorrow we will have a session from Dr.
Thank
Yashik
you, sir. And thank you, everyone, for your patience.
Doctor, please wait. Don't leave. Tomorrow we will have a session from Dr. Yashika Arora Malhotra, and she will be talking about the role of homeopathy in nephropathy. And thank you, Dr. SHWETA, as well as those who attend this session.
Thank you, sir, for giving me opportunity, and thank you, everyone, for attending this webinar. Thank you so much. Good
Thank
night.
you, Dr. Rechita Tripathi.
Thank you, sir. Thank you, sir. Now, as the time is over, so we have to handing over the Malayalam team.
Okay. I'm inviting Dr. P. Shaila to moderate the Malayalam session.
Thank you, Dr. Dhanesh. Thank you, Dr. Shweta, for a nice presentation. എല്ലാവർക്കും നമസ്കാരം. ഇന്ന് IFPHന്റെ ഇടതടവില്ലാതെ തുടർന്നു വരുന്ന മലയാളം വെബിനാറിന്റെ 2125 ദിവസം. ഇന്ന് മലയാളം വിഭാഗത്തിൽ നമുക്ക് ഒരു ക്ലാസ് എടുക്കുവാനായി എത്തുന്നത് ഡോക്ടർ ഹരിഹരൻ സാറാണ്. ഡോക്ടറുടെ ക്ലാസ് കേൾക്കുന്നതിന് വേണ്ടി സൂം പ്ലാറ്റ്ഫോമിൽ എത്തിയിട്ടുള്ള എല്ലാ ബഹുമാന്യരായ ഡോക്ടേഴ്സിനെയും ഹോമിയോപ്പതി സ്നേഹികളെയും സ്റ്റുഡൻസിനെയും വളരെ സ്നേഹപൂർവ്വം ഇന്നത്തെ സെഷനിലേക്ക് സ്വാഗതം ചെയ്യുന്നു. ഹരിഹരൻ ഡോക്ടർ ആലപ്പുഴ ജില്ലയിൽ ആണ് അദ്ദേഹത്തിന്റെ സ്ഥലം. ആലപ്പുഴ ജില്ലയിൽ IHKയുടെ ജില്ലാ പ്രസിഡന്റായി ഇരുന്നിട്ടുണ്ട്. അദ്ദേഹം ഗവൺമെന്റ് സർവീസിൽ നിന്ന് ചീഫ് മെഡിക്കൽ ഓഫീസറായി റിട്ടയർ ചെയ്ത ഡോക്ടറാണ്. കൂടാതെ ധാരാളം പ്ലാറ്റ്ഫോമുകളിൽ ഇതുപോലെ ക്ലാസ് എടുക്കുന്നു. IFPHന്റെ പ്ലാറ്റ്ഫോമിൽ കൂടുതൽ ദിവസവും പങ്കെടുക്കുകയും തന്റേതായ അഭിപ്രായങ്ങൾ പറയുകയൊക്കെ ചെയ്യുന്ന ഡോക്ടറാണ്. പല ദിവസവും ലാസ്റ്റ് അഭിപ്രായങ്ങളാണെങ്കിൽ ഇപ്പൊ സാറ് ക്ലാസ്സുമായിട്ടാണ് വന്നിരിക്കുന്നത്. രണ്ടാമത്തെ ക്ലാസ് ആണെന്ന് തോന്നുന്നു. എന്തായാലും ഇന്ന് സാർ എടുക്കുന്ന വിഷയം കുട്ടികളിൽ കാണുന്ന വിവിധ തരം കോൺസ്റ്റിറ്റ്യൂഷനുകളും ഹോമിയോപ്പതിക്ക് അപ്രോച്ചും എന്നുള്ളതാണ് ഇന്നത്തെ വിഷയം. നല്ലൊരു ക്ലാസ് പ്രതീക്ഷിച്ചുകൊണ്ട് ഹരിഹരൻ ഡോക്ടറെ ഇന്നത്തെ സെഷനിലേക്ക് ആദരപൂർവ്വം സ്വാഗതം ചെയ്യുന്നു. നമുക്ക് ക്ലാസ് തുടങ്ങാം.
ഡോക്ടറെ, ഇത് 4ാമത്തെ ക്ലാസ് ആണേ. സാറ് നേരത്തെയും എടുത്തിട്ടുണ്ട് ക്ലാസ്.
അല്ല, അത് ഞാൻ വരുന്നതിന് മുമ്പായിരിക്കും. ഞാൻ ഇപ്പൊ കഴിഞ്ഞ ഒരു ദിവസവും ഇതിപ്പോ രണ്ടാമത്തെ. അതുകൊണ്ടാണ് ഞാൻ ഇന്ന് ഹരിഹരൻ ഡോക്ടർ ക്ലാസ് ആയതുകൊണ്ടാണ് ഞാൻ കേറിയത് തന്നെ. ഞാൻ കേട്ടിട്ടില്ല. കഴിഞ്ഞ ദിവസം എനിക്ക് കേൾക്കാൻ പറ്റിയുമില്ല. തീർച്ചയായിട്ടും നമുക്ക് ക്ലാസ് തുടങ്ങാം. ഇപ്പൊ തന്നെ 2-3 മിനിറ്റ് വൈകിട്ടുണ്ട്. ക്ലാസ് തുടങ്ങാം. ഫോക്കസ്ഡ് അല്ലേ? ഓക്കെ. കേൾക്കാം, കാണാം, കുഴപ്പമില്ല. ഓക്കെ,
ശരി. എന്തായാലും എൻ്റെ ഈ ക്ലാസ്സിൽ അറ്റൻഡ് ചെയ്യാൻ വന്നിരിക്കുന്ന എല്ലാ ഡോക്ടർമാർക്കും ഞാൻ അഭിവാദ്യം അർപ്പിച്ചുകൊണ്ട് തുടങ്ങാം. എന്താ തുടങ്ങണ്ടേ? ഞാൻ തന്നെ കൺഫ്യൂസ്ഡ് ആണ്. അതായത് പീഡിയാട്രിക് എയിൽമെന്റ്സ് ആണ് തുടങ്ങിയത്. അതുകൊണ്ട് ഞാൻ ഒരു അഭിപ്രായം ചോദിച്ചോട്ടെ. നമ്മുടെ മോഡറേറ്ററൊക്കെ അഭിപ്രായം ചോദിക്കാം. ഞാൻ ഈ ഇപ്പോഴുള്ള ഫീവർ ആൻഡ് കോൾഡ് എടുക്കണോ, അതോ കോൺസ്റ്റിറ്റ്യൂഷൻ എടുക്കണോ, അതോ ബ്രോങ്കൈറ്റിസ് ബ്രോങ്കൈറ്റിസ് ആസ്മ അതെടുക്കണോ, കോൺസ്റ്റിറ്റ്യൂഷൻ എടുക്കണോ, ഇതിലേത് എടുക്കണം എന്നാണ് എനിക്കൊരു കൺഫ്യൂഷൻ. നിങ്ങൾ പറയുന്ന ഏതും എടുക്കാൻ ഞാൻ തയ്യാറാണ്.
സാറ് കഴിഞ്ഞ
എന്താ
ദിവസം
വേണ്ടേ?
എടുത്തിരുന്നത് കഴിഞ്ഞ ദിവസം എടുത്തത് കോൺസ്റ്റിറ്റ്യൂഷൻ ആയിരുന്നു അതേ?
അല്ല, കഴിഞ്ഞ ദിവസം എടുത്തത് ഏതാന്ന് വെച്ചാൽ കുട്ടികളുടെ പല പല അസുഖങ്ങളിലെ
അസുഖങ്ങളായിരുന്നു. അപ്പൊ ഇന്ന് നമുക്ക് ആൾറെഡി കൊടുത്തിരിക്കുന്ന വിഷയം പോലെ പലതരം കോൺസ്റ്റിറ്റ്യൂഷൻ. ഒരു കുട്ടിയെ കണ്ടാൽ നമുക്കത് പിന്നെ ട്രമോർ ആണോ, അത് സൈലീഷ്യ ആണോ, അല്ലെങ്കിൽ വേറെ ഏതെങ്കിലും മെഡിസിൻ ആണോ, ആ ഒരു കോൺസ്റ്റിറ്റ്യൂഷൻ എങ്ങനെ ഓരോ കുട്ടിയെ കണ്ടാൽ നമുക്ക് എങ്ങനെ പെട്ടെന്ന് ഐഡന്റിഫൈ ചെയ്യാം എന്നുള്ളതിനെ കുറിച്ചുള്ള ക്ലാസ് തന്നെ ആയിരിക്കും നല്ലത്.
അതാണോ വേണ്ടേ?
അത് തന്നെ മതി.
കുട്ടികളിൽ കാണുന്ന ഞാൻ വിചാരിച്ചു എന്നാ ഇപ്പം പനിയുടെ സീസൺ അല്ലേ?
അല്ല, അത് നമുക്ക് അത് വേണം. അത് ഇനി അടുത്തൊരു ക്ലാസ്സിൽ നമുക്ക് തീർച്ചയായിട്ടും താമസിയാതെ അത് ആയിക്കോട്ടെ.
ആയിക്കോട്ടെ ഏടാ, നിങ്ങളുടെ ഇഷ്ടം പോലെ തന്നെ ഇരിക്കട്ടെ. പക്ഷെ ഞാൻ വിചാരിച്ചത് ഈ പനിയും കുറുങ്ങലും ഒക്കെ ഉണ്ടല്ലോ ഇപ്പോ, അതെല്ലാം എങ്ങനെയാണ് മാനേജ് ചെയ്യുന്നതെന്ന് പറഞ്ഞാൽ നല്ലതായിരിക്കുമെന്ന് എനിക്ക് തോന്നി. പിന്നെ അതുകൊണ്ടാണ് ഞാൻ ഇപ്പൊ കോൺസ്റ്റിറ്റ്യൂഷൻ എടുക്കണമെങ്കിൽ ഞാൻ കോൺസ്റ്റിറ്റ്യൂഷൻ എടുക്കാം.
ഓക്കെ, അത് മതി.
എന്താ ധനേഷേ?
സാറേ, കോൺസ്റ്റിറ്റ്യൂഷൻ ആണ് ആൾക്കാർക്ക് വേണ്ടത്. നമുക്ക് പിന്നീട്
കോൺസ്റ്റിറ്റ്യൂഷൻ എന്ന് പറയുന്നത്
അതെന്താണോ അങ്ങനെ പറയുന്നത്? നമ്മൾ ഈ മറ്റേ റെസ്പിറേറ്ററി ഇൻഫെക്ഷൻ ഒക്കെ പലതും നമ്മൾ ക്ലാസ്സുകൾ ഒരുപാട് കേട്ടിട്ടുണ്ടല്ലോ. ഈ ഒരു ക്ലാസ് അങ്ങനെ ഒരു അടുത്ത സമയത്തൊന്നും വരാറില്ല, അതേ ഉള്ളൂ.
എന്റെ ക്ലാസ് നിങ്ങൾ കേട്ടിട്ടില്ലല്ലോ.
ഇല്ല, അതല്ലേ പറഞ്ഞ. അതാണ് നമ്മൾ സാറിൽ നിന്ന് പ്രതീക്ഷിക്കുന്നത്.
എന്നാൽ പിന്നെ കോൺസ്റ്റിറ്റ്യൂഷൻ ആയിക്കോട്ടെ. ആദ്യമായിട്ട് എനിക്ക് പറയാനുള്ളത്, ഈ പെഡിയാട്രിക് കോൺസ്റ്റിറ്റ്യൂഷനിലെ മുഖ്യമായിട്ടുള്ള ചില കോൺസ്റ്റിറ്റ്യൂഷൻ ഏതാന്ന് വെച്ച് കഴിഞ്ഞാൽ, ഓറമെറ്റ് 1 ഓറമെറ്റ്, 2 ബാരറ്റൈക്കാർബ്, 3 അർജന്റൻ നൈട്രിക്കം, 4 കാൽക്കേരിയ കാർബ്, 5 ലൈക്കോപോഡിയം, 6 മെഡോറിനം, 7 പൾസാറ്റില, 8 ഫോസ്ഫറസ്. ഇതൊക്കെ പോളിക്രസ്റ്റിന്റെ വകുപ്പിൽ വരുന്നതാണ്. പിന്നെ ഫിലീഷ്യ, പിന്നെ ട്യൂബർകുലിനം, കമോമില, സ്ട്രാമോണിയം, ഹയോസിയാമസ്, സിന, സൾഫർ. ഇത്രയാണ് സാധാരണ പീഡിയാട്രിക് കോൺസ്റ്റിറ്റ്യൂഷനിൽ. ഇതിനകത്ത് നക്സോമിക്കയും കൂടെ ഉണ്ട്. നക്സോമിക്ക ഞാൻ പറഞ്ഞില്ല നമുക്ക്. അപ്പോ നമുക്കിപ്പോ ഈ ഓറമെറ്റ് ചൈൽഡിനെ കുറിച്ച് ചിന്തിക്കുമ്പോൾ ആദ്യ കോൺസ്റ്റിറ്റ്യൂഷൻ എങ്ങനെയാണ് ഈ കോൺസ്റ്റിറ്റ്യൂഷൻ വരുന്നതെന്ന് ഞാനൊരു ചെറിയൊരു എക്സ്പ്ലനേഷൻ തന്നിട്ട് തുടങ്ങാം. അതെങ്ങനെയാന്ന് വെച്ച് കഴിഞ്ഞാൽ നിങ്ങൾക്കെല്ലാം അറിയാമല്ലോ. അതായത് നമ്മുടെ ക്രോമോസോംസ് 23 ക്രോമോസോംസ് ആണ്. അത് ആ ക്രോമോസോംസ് അത് കഴിഞ്ഞു കഴിഞ്ഞാൽ അതിനകത്ത് പിന്നെ വരുന്നത് ഏതാന്ന് വെച്ച് കഴിഞ്ഞാൽ ജീൻസ്. പിന്നെ വരുന്നത് DNA ആണ്. ക്രോമോസോമിൽ DNA ഉണ്ടാവും. DNA കഴിഞ്ഞാൽ പിന്നെ ജീൻസ് ഉണ്ടാവും. ഈ ജീൻസ് എന്ന് പറയുന്നത് ആണ് ഒരു വ്യക്തിയുടെ കോൺസ്റ്റിറ്റ്യൂഷൻ എന്ന് പറയുന്നത്. അപ്പോ നമ്മൾ മനസ്സിലാക്കേണ്ട ഒരു കാര്യം എന്താണെന്ന് വെച്ചാൽ, ഇപ്പം ശൈല ഡോക്ടർ ഇപ്പൊ എൻ്റെ മുന്നിൽ വന്നിരിക്കുക. അപ്പൊ ശൈല ഡോക്ടറുടെ സെല്ല് എടുത്ത് നോക്കുകയാണെങ്കിൽ അതിന്റെ ക്രോമസോംസ് എടുത്ത് പരിശോധിച്ചു. അത് കഴിഞ്ഞ് DNA നോക്കി. പിന്നെ അത് കഴിഞ്ഞ് അതിന്റെ ജീൻസ് നോക്കി. അപ്പൊ ജീൻസ് മാപ്പിംഗ് ആണ്. ഇങ്ങനെ അതിനകത്ത് മാപ്പ് ചെയ്ത് ഇട്ടിട്ട്. അപ്പോ